So good morning, everyone. Finally, we all have logged in and a wonderful day ahead. And to be very honest, trust me, it's amazing to see the smiling faces in the morning because these days this kind of sight is a little rare. So we are extremely humbled and honored by your presence. And with this positivity, I would like to welcome each one of you to IMC NxtGen Health Summit, Reimagine Healthcare. Now today, ladies and gentlemen, the day is very important and it's also special, not because only we are going to discuss the growth, the past, the present of a healthcare, but also because this is for the first time IMC has organized a health summit. So definitely success is on the cards for healthcare today. And ladies and gentlemen, IMC NxtGen Health Summit is an initiative towards establishing a platform for an informed debate on a whole range of issues under the umbrella topic of health involving Indian and international expertise, with participation from medical professionals, hospitals, healthcare providers, insurance providers, health startups, pharmaceuticals, medical device manufacturers, alternate medicines and wellness industries and others. And we have some of the eminent speakers and panelists for the summit who are from WHO India, UN Women, international experts from US and South Africa, and many healthcare experts from India who would be giving insight on future of health, changing face of pharma, also the alternative medicines, future and opportunities in healthcare insurance, and also financing of healthcare and opportunities in medicine. Ladies and gentlemen, we are extremely grateful for all the speakers for accepting our invitation to share their views. And now, the most importantly, we would like to thank Charak Pharma for their sponsorship, support, and to Medscape India for their support, and Avalon Consulting for preparing knowledge paper. We are extremely thankful to all the participants from medical professionals, hospitals, health providers, insurance providers, health startups, pharmaceuticals, medical device manufacturers, alternate medicine and wellness industries, and representative from media for joining today. Ladies and gentlemen, we hope that you all will enjoy the virtual experience and discussing that promise to be extremely enlightening. And now, ladies and gentlemen, I would like to take the show forward. And for that, please allow me to invite Sri Rajiv Poddar, sir, a wonderful human being and a president, IMC Chamber of Commerce and Industry, to give his welcome remarks. Sir, over to you.
Thanks, Inath. Honorable Shri Harshvardhanji, Honorable Shri Rajesh Topeji, dignitaries, distinguished delegates, ladies and gentlemen, a very good morning to all. On behalf of the IMC Chamber of Commerce and Industry, I extend a warm welcome to IMC's NxtGen Health Summit, Reimagine Healthcare 2021. I am grateful to our Honorable Ministers, Harshvardhanji and Rajesh Topeji, for agreeing to be a part of this program in spite of all the crises which we are facing. They have not been able to come physically to be with us today morning, but will be sending us their video recorded messages soon later in the day, which will be played then. A special welcome to Dr. Junaid Ahmed, who has always supported the IMC, and to esteemed Mr. Malone Jalani and Siddharth Shah. I would like to compliment Mr. Juza Khurakiwala ji and Dr. Sunita Dubey ji and members of the IMC Health and Fitness Committee for organizing today's event with such prominent personalities. IMC's summit on reimagining healthcare is so appropriate in today's world. There is a need not only to reimage, but to redefine, refine, and reinvent the entire healthcare system, not only in India, but globally. India's healthcare ecosystem is on the cusp of paradigm shift. COVID has impacted both life and livelihood. Never before has one seen so much attention on health and fitness. The COVID pandemic has put the spotlight on immunity, prevention, and health. Healthcare has become one of the largest sectors of the Indian economy in terms of both revenue and employment, driven by better healthcare awareness, rises in income, increased access to insurance, lifestyle-related diseases, as well as accelerated digital technology adoption. India's healthcare market is expected to reach $372 billion by 2022. The Indian healthcare tech market is expected to grow at 39% compounded annual rate of growth and reach $5 billion by 2023. E-pharmacy saw a 200% increase in the number of orders with the increased adoption. The number of consultations on teleconsultation platforms increased by 300%, and India's e-diagnostics surged in 2020 and is growing at 66%. We will get to more insights on this from Siddharth later in the session. COVID-19 has presented both an opportunity and challenge for India to emerge as the pharmacy of the world. During April-October 2020, India's pharmaceutical exports totaling $11.1 billion witnessed an impressive growth of 18% as against $9.4 billion in the corresponding period a year ago. This has also led to an increase in the share of pharmaceutical exports in India's total export from 5.1% in April-October 2019 to 7.3% in April-October 2020, making it the third largest exported commodity from India. The systems of alternative medicines comprising of the Ayush streams are fast gaining traction and popularity in India and abroad. India has also had the opportunity to boost domestic manufacturing of pharmaceuticals supported by the recent PLI scheme as part of the Atmanirbhar Bharat initiative, alongside offering investment avenues in segments like contract manufacturing and research, over-the-counter drugs, and vaccine. COVID exposed the need for health infrastructure, not only in large cities, but more in rural areas. Further, medical value travel, especially medical tourism, has bright prospects given India's inherent strength in alternative systems of medicine and affordable world-class facilities. Technology advancements and the need for a skilled talent pool has also offered numerous avenues for investment in medical education. Disease management, prevention, and shift to wellness has marked the beginning of a patient-centered, digital-led healthcare ecosystem in India. This ecosystem will not only encourage entrepreneurs to develop new technologies and leverage ideas from every discipline to solve the toughest medical problem, but it will also help promote an enabling policy landscape for regulators to facilitate and provide incentives for innovation. IMC, along with Avalon Consulting, has put together a comprehensive and insightful white paper which covers first-hand information and recommended solutions on how India can make healthcare affordable and, most importantly, accessible to the rural areas in India, as well as proposes a pilot design and rollout plan for the state of Maharashtra. Same will be released later today. Now, more than ever before, we've had tools that help us to harness the power of technology and data, to collect, process, and analyze data faster than ever before, to understand the world, and to change it for the better. India is poised to be the one-stop solution for health. India's strength as a digital powerhouse can be harnessed by the health system to accelerate the progress towards high-quality, affordable, comprehensive, accountable, accessible, and inclusive healthcare for all. In conclusion, I am reminded of a quote by Albert Einstein. In the midst of every crisis lies a great opportunity. For India, the biggest health emergency of our times has not only laid bare the challenges and gaps in our healthcare system, but also an opportunity to invest in well-being and develop a robust and agile healthcare system that can adapt to the changing situations in the time-sensitive manner and make India the health and wellness hub. Let's make most of these opportunities, harness the power of technology, and transform and reinvent the healthcare ecosystem in India. Once again, a warm welcome to all of you. Thank you for being with us. Thank you.
Thank you, sir. Thank you so much for your wonderful words. And now, ladies and gentlemen, moving ahead, I would like to invite Dr. Sunita Dubey, Chairperson, Health Summit Organizing Committee and Chairperson, IMC Health and Fitness Committee, to give introductory remarks. Ma'am.
Yeah, thank you. A very good morning to all of you, and warm welcome on behalf of IMC NxtGen Health Summit. I welcome all our esteemed guests, Honorable Sri Rajesh Topeji, Dr. Junaid Ahmed, Mr. Manoj Jalani, Mr. Siddharth Shah, Mr. Rajiv Podar, Mr. Raj Nair, and Mr. Jujar Khorakiwala, and our speakers and esteemed guests. We are grateful to our esteemed guests from healthcare sector, Honorable Sri Rajesh Topeji, Minister for Public Health and Family Welfare, Government of Maharashtra, and Dr. Junaid Ahmed, Country Director, World Bank, for being with us today. IMC takes pride to felicitating them for their exemplary work for during one of the worst crises faced by the world. Medscape India is also proud to be supporting partner in IMC NxtGen Health Summit. Heartfelt thanks to all our members and associates for their support. I would like to thank NxtGen Summit organizing core team and IMC for their selfless support. Today's summit brings together experts from India and across the globe who have agreed and share their knowledge, experience, and expertise with us. Technology has penetrated all major aspects of healthcare, with the patient care at the core of every development. The way healthcare sector is operating, developing product, and reimagining is being redefined by this emerging technology advancement. The emergence of telemedicine, AI, robotic, digitalization, and government initiatives like e-health, innovation-led research and development, healthcare delivery, manufacturing and supply chain, and disruptive innovation has opened huge opportunity in healthcare. Our panel for the expert will be throwing light on future of health, technology, infrastructure, and education. India is known to be pharmacy of world. We are largest provider of generic drug globally. India pharmaceutical sector supplies over 50% of global demand for the various vaccine, 40% of generic demand in US, and 25% of all medicine in UK. The government is also encouraging growth in this sector, specifically manufacturing and R&D. Our eminent expert will be speaking on the future of pharma, highlighting the untapped opportunity yet to be explored in this sector. Given its ancient time and scientific knowledge, India has emerged as the hub for alternative medicine like Unani, Ayurveda, Siddha, and homeopathy. Today, India is one of the top exporter of alternative medicine in the world. The global Ayush and alternative medicine market is 2019 was approximately 450 million. The market is expected to grow CAGR of 8.6 and anticipated to reach over USD 800 million by 2026. We look forward to our expert discussion on alternative medicine today. The healthcare sector is much diversified and experiencing a new wave of opportunity in different segments like insurance, medical education, medical tourism, and etc. We have experts to make us familiar with the plethora of diverse upcoming opportunity in the healthcare sector. The pandemic is accelerating and use of technology to radically advance medicine and save lives. It's giving the digital health community the opportunity to leverage the incredible progress over past several years in the field, such as the big data analytics, artificial intelligence, remote learning, data interconnectivity, and which reflects that technology is poised to strengthen the healthcare ecosystem rapidly. We look forward to hearing Mr. Barry Swartzberg, CEO, Vitality Group, South Africa, on how technology can be used to make people healthier, followed by exciting fire charge session on technology contribution to understand breakthroughs, innovation in healthcare. A white paper on how India can make healthcare affordable and accessible to the rural health as a pilot design rollout plan for state of Maharashtra put together by IMC along with Avalon Consulting will be released shortly. We are grateful and look forward to listening to all our eminent expert panelists, and big thanks to all of you for being there with us today. In conclusion, the health sector is a strategic inflection point of massive infrastructure changes. Henry Ford once said, coming together is beginning, staying together is progress, and working together is success. IMC NxtGen's Health Summit is a great beginning to come together to share insight and explore opportunity to progress and successful together in charting a new path to create resilient and innovative healthcare system to achieve health for all. Sarvardhanam Pushtivardhanam. Everyone should be healthy and prosperous. Thank you. Jai Hind.
Thank you, ma'am. Thank you so much. Well, Dr. Dubey definitely is a beautiful amalgamation of beauty, brains, hard work, and positivity. Thank you so much for your wonderful words. And now, ladies and gentlemen, may I now please request the white paper may be put on screen and request Sri Rajiv Podar sir, the President IMC, Sri Juzer Khorakiwala, Vice President IMC, to press enter on their computers to unveil and release the paper, Improving Accessibility, Affordability, and Quality of Primary Healthcare Delivery in Rural and Low-Income Groups, prepared by Avalon Consulting.
Thank you, Zinat. I would request all on the panel, Junaid Bhai, also Mohanji, Siddharth, Dr. Dubey, please also do the honors. We'll be grateful. Zinati, could you ask, could you take it over from there and request Raji to give us an overview?
Can I request Mr. Raj Nair to say a few words on the paper, sir?
Yeah. Thank you for inviting me and giving this opportunity to talk about what we can do about rural healthcare. Good morning and greetings to the guests of honor, the President, Vice President, and Governors of IMC, members of the organizing committee, and all the dignitaries and participants in the Healthcare Summit today. Imagine you're in a large city, say Mumbai. You have a family member who's in bad shape due to COVID and who needs to be in an ICU. But forget about getting an ICU. There are not even regular beds available anywhere. You have no access even to an oxygen cylinder while you wait for a bed to appear. Now you manage to get a bed, but the ambulance is going to take 6 hours to reach. You're desperate, you're worried sick, you're inconsolable, you're frustrated. Now this is happening in many households across cities in India as I speak, despite the best effort of the government and hospitals. Friends, you now realize that access to healthcare matters more than anything else you valued all these years. Now listen carefully to this. This is happening in rural Maharashtra, in fact, all over rural India, not just during COVID, but all year round, year after year, and for the last so many years. It is much worse than you imagine. People suffer when they don't need to. People die when they don't need to. People have to go to private hospitals which they can ill afford. And they even go to quacks. The IMC Chamber of Commerce felt that it's urgent to do something about this and wanted to assist the government of Maharashtra with a way to solve this problem. So they approached Avalon Consulting to study the situation and recommend a solution to this problem. I was delighted to offer our services pro bono. So our goal at the outset was to substantially improve access to good healthcare in rural areas and to keep it affordable or even free. It was very clear soon after we started work that the government is trying very hard, but there are problems on many fronts and the challenges are daunting for many reasons. They have implemented a very good concept of rural healthcare. One tertiary health hospital in a big city takes care of many secondary rural hospitals. Each such hospital takes care of a number of primary health centers, and each primary health center takes care of a number of sub-centers at the village level. So there's a logical progression for a patient from the sub-center all the way up to a tertiary hospital in the city, depending on the complication which arises at each level. So in theory, it's a brilliant idea. And they've built infrastructure across the country, across the state, equip them with not just hardware, but also software to manage their operations in the manner in which the government wants it to be. And that's so far good. But as is often the case, the best of ideas become victims of the devil of implementation. Starved of financial and people resources for a prolonged period, this system, which is meant to be good, is suboptimally managed and has largely failed to deliver. India is not the only country where this is happening, but we are worried about India right now. Periodic attempts to revive the system have not succeeded to provide reliable healthcare to rural folks. So we looked at various solutions and concluded, after doing the diagnosis, and concluded that the best solution would be one where we can combine the government's infrastructure and ability to govern with the private sector's ability to manage resources effectively and efficiently, and with the desire of some of them to give back to society. So the private sector could adopt a cluster of a rural hospital, a number of PHCs under that, and a number of sub-centers under that, and reselect that healthcare cluster by restoring the infrastructure, upgrading the equipment at their own cost, and recruiting personnel to operate the healthcare center efficiently. The patients continue to receive free treatment as at present, because you're following government rules, and the government of Maharashtra would reimburse the operating expenses every month. There would be no profit for the private sector in this PPP arrangement because it's meant for goodness and for improving things. So it's like a CSR activity. We were encouraged to find something very similar in spirit in the Mahabaleshwar Rural Hospital and its associated primary healthcare centers and sub-centers, which was a joint initiative of the government of Maharashtra and the Red Cross. And the Red Cross roped in Mr. Jaisingh Mariwala, an industrialist, and his group of donors. The rural hospital in Mahabaleshwar, which was defunct for 25 years, was resurrected in 6 months flat. The new avatar is so beautifully equipped and so well equipped and so clean that I'd love to be admitted there if I had to fall ill. It is cleaner than 95% of the hospitals and nursing homes in Mumbai, far cleaner. It would take care of affordability because it continues to provide this services despite the upgrade and better quality of services. But what about access? Now, coming to access, our goal is that the rural patient should get access to healthcare, which on some parameters is even superior to what their urban cousins get. For instance, a common man in a city goes to a doctor for something more than a cold or a fever. He is often recommended some tests, or he is passed on to a specialist who will also recommend some tests. And by the time the tests and consultation's over, it's about 4 to 7 days before the treatment starts. We want a solution that will just take 2 hours, not 4 to 7 days, in the rural areas for most diseases, from consultation, diagnostic, and medicine in hand. Now, it looks like a tall order, 2 hours versus 4 to 7 days. But this can happen only if technology is adopted. So in our report, we have described a couple of types of digital platforms that could have an electronic inpatient information database, audio and video connectivity which allows telemedicine. This is not very expensive. Okay, it costs about a lakh a month. They can be as an operating expense, and it will serve a huge number of patients. And on that platform would sit various applications which are connected to devices, which are again not very expensive and which are available in India because there were some very, very innovative startups and other companies, mature companies, which are making these available, both the hardware and the software. So I'll give you one example. You can easily get an inexpensive artificial intelligence-based digital pathology machine, which can do a blood test. And that blood test can be done by an ASHA worker, not a qualified pathologist. And it can deliver up to 35 parameters. Okay. Now the beauty is that the results will be out in 10 minutes, and the results will automatically be transferred immediately to the platform. And the doctor can see it on his screen along with the patient's history of illness and medicines taken so far and the clinical discussion there and the blood test report, all in a matter of 10 minutes. And therefore he or she can diagnose and recommend medicines to be dispensed at the same place. If there is a complication and he needs guidance, he can just tap into the platform and connect with one of the many specialists who are sitting in some other cities who have made themselves available because they want to do something in their spare time for rural India. And we know we are connected with many people for that. And get advice on what should be doing. Now, this doctor sitting far away in Mumbai or Pune can actually see all the same thing that the other doctors saw, including the blood test report instantly, and therefore able to diagnose and guide the doctor in the rural area. So the doctor also benefits from the experience. He's not anymore in the boondocks, literally, because of the connectivity. And the entire cycle time could be 1 to 2 hours, depending on the queue at the primary healthcare center. A common man in the urban Maharashtra cannot hope to get anything close to that in terms of speed and quality, and that too free. So we're going to up the ante. Now, Piramal Swastha, which has developed a well-designed platform that meets our requirements, were prepared to do the pilot study for 3 months free of charges. The cluster would have to pay only for the technology vendors on their platform. And we have recommended how the government could roll out this solution across the 36 districts of Maharashtra. IMC and Avalon Consulting will be happy to discuss this in more detail with the government of Maharashtra. And likewise, I would appeal to the socially minded business groups in Maharashtra to proactively engage with the government of Maharashtra to adopt a cluster. It is now up to the private sector and the government to take this forward. If the twain can meet, it will herald a new beginning in India's healthcare system for rural poor, not just Maharashtra. A big thank you to IMC Healthcare Committee members, experts from various technology companies whom we consulted, Piramal Swasthya, Father Tommy and his Red Cross team, Mr. Mariwala and his team at MG Rural Hospital, and the Avalon team, especially Nitisha Dhawan, who have contributed significantly to this paper. I have one more pleasant duty to perform. Dr. Mukesh Batra has just released a book on the wonders of homeopathic treatment. Here it is. And you can get a free copy by messaging him. And copies of our white paper are also available free of cost to whoever is interested. Thank you very much for your attention.
Thank you. Thank you so much, sir. Thank you, Raj, sir, from Avalon Consulting for giving us the overview of the white paper. And now, ladies and gentlemen, I would like to invite to read our special guest, Sri Siddharth Shah, co-founder and CEO, API Holdings. Ladies and gentlemen, let me just give you a little brief about Mr. Siddharth. He is a co-founder and CEO of Pharmacy, the largest digital health platform in India. He brings with him in-depth understanding of pharmaceutical supply chain, Siddharth sir is focused on bringing radical reforms in the healthcare industry with the help of digital technologies. Ladies and gentlemen, he believed in bridging the three pillars of healthcare: accessibility, availability, and quality through creating a holistic ecosystem connected with technology. Ladies and gentlemen, he is a IIMA alumni. He completed his graduation with focus on computer engineering from DJ Sangvi College, Mumbai. And not just this, ladies and gentlemen, Mr. Siddharth was raised in Mumbai, India, and he is an avid go-karting driver and holds several awards at the national level. Wow, that's quite an interesting bio. And now, ladies and gentlemen, this is Mr. Siddharth Dev. Sir, over to you.
Hello and good morning to everybody, and big thanks for having me over and join this forum. Uh, I think we've had the pleasure of listening to some of very established and very successful folks talk about healthcare and how today that seems to be the absolute top priority for all of us concerned, right? I think no matter uh, what your economic status is, your social status is, I think the number one thing on everybody's mind today is healthcare, right? And I think it's a it's the perfect step that forums like IMC are taking today to ensure that there is more awareness, more thought leadership, and more participation to get affordable, accessible healthcare to everybody. Uh, I think we would like to believe at least that our life's mission actually is to continue to provide affordable, accessible healthcare to each and every person, right? And I think that's what we're doing through our various platforms. In a nutshell, we already have our B2B platform, which today provides medicines to 80,000 fragmented retailers across India in a span of less than 4 hours. Right, so we do that by digitally empowering them to procure any and every medicine that you need in a span of less than 4 hours. And going ahead, our app Pharmacy works with these 80,000 retailers to ensure that today these medicines are made available to customers in every zip code of India, often in times of a couple of hours, right? We've recently merged with another e-pharmacy called MedLife, and between Pharmacy and MedLife, we actually serve over 20 lakh patients every single month, and ensure that they get access to affordable medicines, quality medicines, and so on and so forth, right? But I think this is not the time for me to speak about what we're doing, but this is actually the time for us to think about what we can do together as an ecosystem. And I think the need of the hour, as we've seen, is digitization, right? I think I cannot stress enough around digitization and the need for digitization. I think the first challenge that we're all seeing consistently is the fact that outpatient healthcare is something that is paid from out of pocket. While it may not affect people at the higher economic strata so much, for a lot of people at the lower economic strata, it's literally roti, kapda, makan, and dawai, right? That you have to pay for. It's necessary for your survival. And for your dawai, it's a travesty that we still have to pay from our pockets, and we don't have an ecosystem of insurers or third party payers who can do it. And I think at this point of time, this is one of the areas where I would actually not like to blame the government for not doing enough. I think in fact they are pushing everything, but I think it's time that we as the private sector took up enough and more, right? On our on the toothpaste and the shampoos that we take, we have a QR code, but it's a shame that we don't have a QR code on our medicines, just as an example, right? And I think having digitization across the ecosystem, across the producer, across the pharmacy, across the patient, and e-medical records across the practitioner is absolutely the necessary and the perfect and the right thing to do. What this will allow us is the way Mr. Nair was sharing about providing access in hinterlands, right? I think in urban areas, a lot of things that we take for granted, but having these digital ecosystems is extremely critical and essential to have your patients get access to healthcare no matter where they are, no matter how they are, right? And having records in digital format just makes it easy and interoperable. So if you look at each leg of interaction, right, between the pharma company to the producer, you need digitization in the supply chain to ensure that only authentic medicines are in the supply chain and there aren't counterfeits. between the pharmacy and the patient. You need a digitization to ensure that the patients are able to access their medicines no matter where they are. And the fragmentation of the industry becomes a leverage and not a hindrance, right? And what I mean is, your average pharmacy is 3 to 400 square feet and cannot store more than 3 to 4,000 medicines, which often makes it inaccessible for everybody to get all the medicines. But ensuring that you have a digital ecosystem and a digital footprint will actually, rather than a centralized model which you see in the US, right, where you have few large pharmacies catering to a lot of people, we have a decentralized model and we can actually make them as point of connect for the last mile access, right? But just ensuring that there is a digital supply chain to ensure that the right medicines are stocked at the right time. Similarly, the interaction between the patient and the practitioner, which is the doctor, I think that digitization also makes a ton of sense to ensure that your records are digital. And I do think that this is the time where our industry has to come together and invest significantly in digitization, right? Today, everything that we do from the confines of our home is more or less digital. But I think healthcare is one area where still significant investments need to be made by all of us to achieve this end goal. And I think that the government has taken absolutely the right step, right? And we must commend the government in terms of what they're trying to do with the National Digital Health Mission. And I do believe that in India, some of our leaps have been quantum leaps, right? If you look at what's happened in the world of finance, uh, the world moved from cash to check, from check to cards, and cards to digital. With the advent of UPI, in 5 years, we've moved from cash to digital, right? And we've created a decentralized system, which is not replicating the West, it's not replicating China, it's our own Indian system, right? Which is today leading in micro payments. I think that same leadership in digitization of primary healthcare is the need of the hour, and doing that impetus on digitization requires stakeholders to invest in each leg of the ecosystem, right? And I think once we are able to do that, rather than spending thousands of crores of rupees and billions of dollars on recreating physical infrastructure, if we relay a digital network on top of this physical infrastructure, I think we can significantly enhance the potential of these things. And I believe that, if anything, these times have taught us to continue to respect our health, not take it for granted. And to that extent, I think that companies like ours are trying our best in our mission to continue to digitize healthcare. And we believe that we should expand our presence today from 80,000 retailers to about 200,000 retailers in the next 2 years, and from about 20 lakh patients to 50 lakh patients in India. It's a small step from our end in some direction, but I do believe that with the active participation of everybody in this country, and small steps towards creating more and more digital interfaces, we can significantly solve issues around affordability, accessibility, and authenticity with respect to healthcare in this country. And once again, I urge everybody and request everybody to take the best of care for their health, and to ensure that we paid forward and invest in the ecosystem to ensure that it's available and accessible to every Indian. So thank you very much once again.
Thank you, sir. Thank you so much for your wonderful words. Well, ladies and gentlemen, today we have definitely understood the importance and value of good health. And with this summit, definitely growth in healthcare is on the cards. And now, ladies and gentlemen, moving ahead, I would like to invite our special guest, Sri Manoj Jalani, Director, Department of UHC, Health System of Life Course for the Southeast Asia region, WHO. Ladies and gentlemen, Mr. Manoj Jalani is the Director, Department of UHC Health System and Life Course of the Southeast Asia region of World Health Organization, WHO. Mr. Jalani is an IAS of 1987 batch, an IIT alumni, and of University of Birmingham, UK. Before WHO, ladies and gentlemen, he was the Joint Secretary and later a Mission Director, National Health Mission, while holding the post of Additional Secretary and Special Secretary, MOHFW, Government of India. He has co-authored several papers in the area of health systems and policy and has many awards and has accomplished to his credit, including the Uni ATF Award for his contribution towards addressing NCD challenge in India. Ladies and gentlemen, now with these wonderful minds working, success is definitely there. So here, this is Mr. Manoj Chalani for you. Sir, over to you.
Thank you so much, Honorable Union Minister of Health, Dr. Harshvardhan, Honorable State Minister for Health, Shri Rajesh Tope, respected President of IMC, and all other distinguished participants. I bring to you greetings from the World Health Organization. At the outset, I must congratulate IMC for this initiative for an informed debate on a whole range of issues under the umbrella topic of health, involving both Indian and international experts from diverse fields. My topic is universal health for all. So universal health coverage is the principal vehicle to achieve health for all, and I'll talk on that. UHC means that all people and communities can use the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that use of these services does not expose the user to financial hardship. So I want everyone to recognize the emphasis on all people. That means no one left behind. All health services throughout the life course. The quality for all, I mean, most like a high and uniform quality for everyone, and financial protection. Now, there is enough global evidence to demonstrate that UHC contributes not just to improved health outcomes, but also reduction in poverty, enhanced productivity, increased jobs, particularly for women, enhanced equity and efficiency, and accountable health systems. It also promotes community solidarity. The UHC, therefore, not only underpins the SDG 3 targets, but several other SDG goals. Against the backdrop of global pandemic that has caused disease, death, and disruption, the case for UHC is clearer than ever. Strong and equitable health systems that leave no one behind create populations that are healthier, more productive, and financially secure. Resilient health systems are the bedrock of emergency preparedness and response, and ensure that when acute events do occur, like just now, essential health services can be maintained. For the Southeast Asia region of WHO, this has been the key points of focus throughout the pandemic. And in fact, for the last 7 years, since 2014, achieving UHC has been one of the flagship priorities for the World Health Organization for Southeast Asia region, with focus on strengthening primary level care, by particularly increasing access to medicines and strengthening the health workforce. Now, normally we track the progress on UHC through the coverage of essential health services and financial protection. So for the SDGs, when you monitor the progress on UHC, you look at how much has the coverage improved, how much has the financial protection improved. Now, in terms of coverage, India has done, India is doing well. There's improved service coverage from 50% in 2010 to 63% in 2019. And we've also added considerable health workforce. However, the proportion of families that face catastrophic health spending, or the overall OP of over 60%, that continues to be a major concern. Now, we recognize that we need strong health systems that are resilient and help accelerate progress towards its UHC. Now, what does India need to do to accelerate its progress towards UHC and health system resilience? So I'll focus my talk on that and list some areas of attention. The first and foremost is we need to enhance public spending on health. Public spending on core health by the union state governments at about 1.2% of GDP in India is very, very low compared to the peers and by the global yardstick. And that in turn gets reflected in high out-of-pocket spending and poor investments in common goods for health. Now, we recognize that out-of-pocket spending at the point of care is regressive and inefficient, and we need to move to pooled financing of healthcare and not through out-of-pocket spending. Now, when I'm saying enhanced spending, public spending on healthcare, we do recognize that the pandemic, besides its direct and indirect impact on morbidity and mortality, has also majorly affected the economic activity on account of lockdowns and voluntary social distancing. And there are different estimates for the Southeast Asia region. I mean, as per the World Bank and WHO work together, for 2020, they said that there would be an economic contraction of slightly over 5%. Now, obviously, this could then have severe consequences for financing of health systems and sustaining progress towards UHC. Now, we also realize that countries will now have to invest substantially to vaccinate their population. Reaching 70% of population to get some semblance of herd immunity is going to pose substantial fiscal burden. We recognize the fact that there's economic contraction. We recognize the fact that there are countries will need to invest in a major way significantly for the vaccination, for the vaccines rollout for a very large chunk of population. But despite that, we will need to enhance public spending for not only for improving health, but also for equitable economic recovery. So we will go for sustained counter-cyclical public spending and priority health within the government budgets. Now, what we are suggesting is that governments need to enhance their public spending on health by prioritizing health in their government budgets, despite the fact that budgets itself are shrinking. So only way to increase public spending is by enhancing the share of health in the budgets. The second, of course, they'll have to spend money on the pandemic and social protection measures and vaccination. And we also suggest that government should think in terms of pro-health taxes to mobilize additional dedicated resources for UHC and health systems. Now, not only do we need, the second point is that not only do we need more resources, we also need to invest them strategically and efficiently to sustain and expand coverage with priority for the poor and vulnerable. Now, here I would suggest that India needs to prioritize public spending on primary health care. We heard our speakers explain how a major part of out-of-pocket spending, over 60% of our out-of-pocket spending is on primary care, and of that, almost 70% is on medicine. So we need to strengthen primary health care. We need to strengthen essential health functions, and primary care with integrated to the higher levels of care. I mean, so you need to have continued care, integrated care, and coupled with that, you need to engage with the communities and have multi-sectoral action. So the primary health care in WHO has launched this operational framework. That kind of primary health care would be critical, would be efficient, would be equitable, and would help in terms of not only achieving the UHC, but also resilience. We also need to invest in core public health functions that underpin both the health and economic security. I mentioned, I mean, we have seen examples in Tamil Nadu, in Rajasthan, where systematically governments have made efforts to improve access to essential medicines. When you buy generic medicines in bulk, you will most get drugs, essential drugs, at 1/5 of the cost. So it's a low-hanging fruit, and you can bring a huge reduction in out-of-pocket expenditure for the public at large. The other idea, which Mr. Nair also referred to, was in terms of how do we use the private sector and the NGOs to collaborate and use their respective strengths. I know, I mean, we look at PPPs, and we know that in the infrastructure sector, PPPs have done very well. In the social sector, they have not done so well. I think we need to create an appropriate ecosystem and build the capacity so you can have an appropriate regulatory framework, as well as building capacities of the state governments to engage in the PPPs. We have had some success in PPPs, like ambulance networks, diagnostics, mobile hospitals. In fact, the secondary and tertiary hospital care under PMJY, etc. but we still have not used the full potential when we recognize that almost 3/4 of outpatient care is by the private sector. So obviously there is a much greater potential and that needs to be leveraged, and we could have proper strategic purchasing arrangements for that. Also, I did talk, I mean, we have a very fragmented healthcare system and each facility works independently. There is a need for integration, and digital ecosystem could facilitate integrated continuum of care. The other issue is in terms of quality. I think there is, we don't, this is not discussed so much, but when you look at terms of the impact on health and the impact on the economy, just to give you some figures, in our low middle income countries, we have 1 in 4 patients who are harmed, and there are almost 134 million annual adverse events due to unsafe care just in the hospitals alone. And 2.6 million deaths are on account of poor quality, and most of the almost 83% of harm to patients in healthcare is avoidable. And in terms of economic implications, so there are a direct cost of resource wastages and indirect costs in terms of loss of productivity. But as per a study on adopting a human capital approach, it said that eliminating avoidable harm could boost economic growth by over 0.7% a year. And if you compound it for a decade, it would total up to almost 29 trillion US dollars. So we need a concerted and systematic drive to build in a culture of quality patient safety. Another area is the HRH. We have done well in terms of creating this National Medical Commission. The numbers are growing, but still, there is a shortage of specialists, doctors, nurses, midwives, and allied health professionals. There's also the problem of quality. There's a problem of distribution, interstate variations, intrastate variation, rural-urban variation, and the issue of skill mix. So we have some excess, like dental doctors or Ayush doctors are much more in number than probably we need. And on the other hand, there are so these challenges need to be addressed. I think Allied Health Professionals Bill, once that comes through, could provide for both the needs of the country as well as also fulfill global needs. Now that India is out of those countries from where medical professionals should not be exported, so we are out of it, and we could export HRH, and we could meet that. The other issue is about epidemiological transition or shift, and we realize that NCDs now constitute 60% of the disease burden, and the majority of deaths on account of NCDs is premature. So you have not triple burden, you had communicable diseases and maternal child complications, you have the emerging infections like COVID and the NCDs, and we need to now improve our care for the NCDs for both health outcomes and again for economic reasons. I don't want to belabor the point in terms of creating the right digital ecosystem. We have now the National Digital Health Mission. We looked at the value of how teleconsultations have been such a relief for providing consultations to remote areas during these COVID times. But there's a huge potential of use of technologies, whether it is not only the IT and digital health, and you have a good roadmap through Digital Health Mission, and I think public-private sector need to work together to operationalize that as early as possible, but also use the other technologies, artificial intelligence, machine learning, big data, Internet of Things, other disruptive innovations to improve access, affordability, and quality of care. Other areas in terms of data and health information systems, I think we really need to work to, this is needed for accountability. This is the basic thing. It's unfortunate that India, when you look at even the CRVS, the basic data on births and deaths and the cause of mortality, that data is not available. In fact, only for 20% of deaths, we get the cause of death. Now, unless we know why people are dying, we will never be able to prioritize those interventions which will reduce those disease conditions, which will reduce those risk factors that contribute to those diseases. So both the national, state governments and the local governments need to work to make sure that we have robust CRVS, we have a robust cause of death data, and then prioritize our interventions based on the evidence. And we also need to create robust health information systems to be able to see how our policies and programs indeed are making a difference. The other couple of issues, one is in the issue of equity. I think whether it is rural, urban, income categories, social categories, gender, there are huge disparities, and UHC aims to address that, and country needs to prioritize the needs of the poor and vulnerable. We recognize that health outcomes don't depend so much on actions within health, but also in actions in all other policies. So you have the social and environmental determinants of health, which contribute to over 50% of the health outcomes, and you need health in all policies and multi-sectoral action, whether it is pandemic response, whether it is antimicrobial resistance, whether it's climate change, etc. And lastly, and not the least, is in terms of improving the governance. I think we need to really work hard in terms of creating a culture, a transparent and accountable governance which enhances trust of the community to the health system, which would then be also effective, efficient, and equitable. I think the pandemic is this crisis is also an opportunity for health sector to innovate and take some tough, drastic measures. And I think we've known the link between good health and the economy, and COVID-19 has exposed the weaknesses and gaps of our current health system. It's not that they were not there, it's just that they've got exacerbated and exposed now. And we need to reform and commit to UHC, and that need is more urgent. I think history will judge us how we use these difficult lessons from this pandemic to build healthier, more sustainable societies and economies. I think together we must achieve health for all to protect everyone, because our lives, livelihoods, and futures depend on it. Investing in health system resilience and achieving UHC is not only moral, but also critical for inclusive and sustainable economic development, and it cannot afford to wait. So stay safe, stay healthy, and stay happy. Have a good day. Bye-bye.
Thank you, sir. Thank you, Mr. Jalani, for your wonderful words. It was indeed a wonderful talk. And now, ladies and gentlemen, moving ahead, I would like to invite the President, Mr. Ajit Mangrulkar, to felicitate our guest of honor, Dr. Junaid Ahmed, Country Director, World Bank, as game changer for his contribution towards helping India during pandemic.
Thank you, Sheetal. Thank you, Zeenat ji, and thank you, Rajiv ji. It's a proud privilege moment for us at IMC to honor Dr. Junaid Ahmed, Country Director for the World Bank in India. Good morning, Dr. Junaid, and I would like to read the citation that we have for you in your honor. Dr. Junaid Ahmed is the Country Director for the World Bank in India. A Bangladeshi national, Dr. Junaid was formerly the Chief of Staff to World Bank Group President Jim Yong Kim. He joined the World Bank as a young professional and worked on infrastructure development in Africa and Eastern Europe. He has since held several management positions, leading the bank's program in diverse regions, including Africa, the Middle East, and North Africa, as well as in India and South Asia. Dr. Junaid has been instrumental in getting the World Bank working closely with Indian government to support India's own COVID-19 response strategy and to help the country as it builds back better after the pandemic. Early on during the outbreak of the pandemic, he got the World Bank to partner with India in a $1 billion health project to help strengthen health facilities in states, procure essential medical supplies such as testing kits, PPEs, masks, and ventilators, and ensure all urban and rural health workers. Apart from securing support from the World Bank for India's health sector, World Bank India under Dr. Junaid's leadership secured $1.15 billion from the World Bank to finance India's social protection programs to support poor and vulnerable communities during the lockdown. He was able to get the World Bank and the Indian government to sign $400 million project aimed at protecting India's poor and vulnerable from the impact of COVID-19. Before that, Dr. Junaid secured approval of $750 million that enabled immediate cash transfers to about 320 million individual bank accounts identified through pre-existing national social protection schemes under the Pradhan Mantri Garib Kalyan Yojana and additional food rations for about 800 million individuals. IMC applauds the phenomenal role of a partner that World Bank under your leadership has been playing during the pandemic to help India mitigate the crisis. He was able to get the World Bank to allocate close to $3 billion and arrange for India to fight COVID. In recognition and appreciation of your efforts as head of the World Bank India, we would also like to felicitate you as a game changer. Thank you so much, Dr. Junaid Ahmed, for all your sterling efforts and fantastic role that you have played in your role as World Bank Chief in India and for India. Thank you very much.
Thank you, Atul sir, for reading the citation. And now, ladies and gentlemen, moving ahead, I would like to invite Dr. Junaid to address the attendees. Dr. Junaid, may I please have you here? Thank you.
Thank you very much. It is an absolute privilege and honor to be here today addressing the members of IMC, and I want to thank IMC for this platform. I must say that I'm both surprised at the award that you've given and a bit embarrassed because ultimately the game changer is not a single person in the World Bank, but the game changer, I'm very proud to say, is the institution called the World Bank. This is an institution that is owned by 189 countries of the world. And India, one of the core founder members of the World Bank in 1946. In fact, a delegation led by Mr. Deshmukh at that time came up with the name, the original name of the World Bank, International Bank for Reconstruction and Development, IBRD, and was instrumental in actually creating the shareholding rules for this cooperative, this global cooperative to come through. India has always been a major partner of the World Bank. It was the leading partner of the International Development Association, the IDA, which is the resources and support that the World Bank gives to low-income countries. And when India transited from low income to low middle income, it moved from IDA to IBRD lending and is now the largest borrower of the World Bank. It accounts for 16% of the World Bank's loan globally in IBRD. And it is India that creates the platform for the World Bank to play the role that it has to play. And I am happy to receive the title of Game Changer on behalf of the World Bank and on behalf of all my colleagues at the World Bank, those who work on safety nets, those who work on health, those who work on education, those who work on MSME, those who work on agriculture, those who work on transport, those who work on urban. As you can see, we are across all sectors in India, and we are across the whole federal system in India. We are almost in every single state, and it is the largest development partner. And it is absolutely an honor and privilege to represent the World Bank in India, and more so as a Bangladeshi. It is an era of where regionalism is very important, and the ability from someone from Bangladesh to be here in India to learn from the Indian experience, to support the Indian process, and to really be part of the World Bank in India is an honor. Let me take a few moments to maybe offer a slightly different reflection. It's interesting, as we listen to the speakers in this presentation today, we went from very much a private sector approach, which talked about delivery of health services and using private sector, using technology to get to the last mile delivery of health services. But as we began to move from the speakers from private sector analysis in terms of reimagining healthcare, we then come to WHO and Manojji, and Manojji begins to shift the needle of our discussion from private sector health delivery into the arena of public health or public goods. And that's a significant shift. And it's a shift that I want to stress Because I, as a speaker from the World Bank, will take the shift completely away from reimagining health services to what I'm going to be calling reimagining public health. Now, what's the difference? Public health is a population scale initiative. Public health affects the whole nation, but it is not about the cure, it's about the prevention. Public health is about prevention. And I would argue what the pandemic is telling us is more than ever, we need to reimagine public health. By public health, what do I mean? It is a focus, as I said, on prevention, and it is a focus on immunization, disease vectors, monitoring of disease outbreaks, fighting epidemics, drug safety, food safety, air quality, water quality, waste management, disaster risk resilience, disaster response. These are all elements of public health. And as you can see, that public health is not restricted to the Ministry of Health, but it's really across ministries and across the federal system of India. Today, there is a need for us to reimagine public health to ensure that India, and indeed as India discovers, so does the rest of the world, how does India deliver air quality so that we don't find people going to doctors with lung disease? How does India improve community disease surveillance so that we do not reach a crisis level of a pandemic hitting India, that pandemics can be localized and can be dealt with? How is it that we can ensure that road investment is not just about beautiful highways and cars speeding and less congestion, but that there is less accidents in on the highway, that you do not have to look at injury and deaths in highways, and road accidents in India is one of the highest in the world. How do we make the system actually invest in public health? And that directly relates to what we call state capability. What the pandemic has shown, that not only do we need to invest in reimagining public health, which is the world of prevention, we need to invest in health capability of the public sector, right? And here, let me unbundle that a little bit. I recognize that a private sector could take a group of, say, state district hospitals and run them. And that could be a great partnership. And indeed, there are good examples of such public-private partnership. But let me suggest to you that in today's state of district hospitals, the investments we need to build state capacity to manage is far greater than the need to figure out how to do a PPP arrangement. Because you could not come up with a contract that could actually reflect an honest, accountable contracting between district hospitals in a, say, UP and a private group like an Apollo. There is no way we could come up with the right price that would hold accountability and service delivery. Why? Because the district hospitals themselves need to reach a certain level of capacity before you can enter into these kind of public-private partnership. There's a need to actually invest in public capacity. And I gave you the example of district hospital. But perhaps the biggest discovery of a need for investment in state capability is what I would call urban state capability or urban health capability. We know that COVID-19 starts off in cities and it becomes an urban problem. When we talked about lockdown of India, it was really lockdown of the cities. And when we talk about unlocking of India, it is unlocking of the cities. The question I ask you is, does India have at the third tier, at the city level, an health cadre that actually delivers public health at the city level? Public health at the city level that deals with water quality, disease surveillance, pollution control, vector control, mosquitoes, etc. I think that India needs to reimagine urban public health systems today. And to reimagine urban public health system, I think one of the biggest challenge that public health has in India is what is the paradigm of India managing its third tier? How will India manage its cities? What's the governance model of cities? If we can't answer that question, we will not be able to answer the question of how do you create a urban public health system. I gave a presentation once in Mumbai to a lot of young people. There were about 1,000 young people. And I asked them to raise their hand if they knew the name of the chief minister of Maharashtra. And 100% of the hands went up. I asked them to raise their hands if they knew the name of the mayor of New York. And I would say about 60% of the hands went up. And then I said, can you please raise your hand if you know the name of the mayor of Mumbai? I would say about 20% of the hands went up. How is it that one of the global cities of the world, global metropolis, has a mayor and only 20% of Mumbai's young population that I was speaking to in that 1,000 audience, only 20% knew the name of the mayor? It reflects that we have not yet figured out a paradigm of strengthening the third tier of India. And I would say that the strengthening of the third tier is directly related to supporting strong public health, health that deals with public interventions that will deal with prevention at the third tier in an urbanizing India. And that's one example of what I call investing in state capability of public health. Then I want to take it to another level, and it's a point that was raised in a conversation by Deepak Prem Narayan and Kiran Mazumdar-Shaw. And when I asked them, then what would be one of the most important intervention in public health, interestingly, their response was, we need a regional public health system. What they're saying is that in order for us to deal with pandemics, and there will be more pandemics in the future, this is really a wake-up call, and we're going to see more climate shocks in the future. How we create in the region a network of public health, where we go to the strengths of each country and draw upon the strengths to come in during a matter of crisis, becomes very important. How do countries in South Asia invest in vaccine development? How do they actually invest in vaccine production? How do they invest in PPE production, right, during a time of crisis? And you need a regional focus. This is a regional state capability. Now, you might ask, why is Junaid coming to IMC, a private sector organization, and talking about public health, prevention, which is a pure public good? What's the connection? And here I have to say that the private sector has a huge role to play, and it has to play in two ways. First, you heard in the first part of our introductions today how private sector can deliver health services, health care at scale using technology, using its flexibility, its agility, its ability to build capacity. Not a problem. And in delivering public health, i.e. management of road safety, management of water quality, management of air pollution, there is huge business for private sector to come in support of public health. But that is not what I'm talking about, because you know about that. You know when there is a case where a private company can go and make a profit in delivering services. I'm not worried about your ability to do that. What I'm worried about is your ability, your motivation to lift the discussion on public health. Now, to lift the discussion of public health, we need private sector to invest in think tanks, to invest in universities, so that India can invest in its own research about what is public health. A lot of the CSR money, and there's a debate where it should go, and a lot of you as private sector have invested in foundations, in service delivery. I learned so much from my colleague and friend Deepak Prem Narayan when I saw that his organization and his effort and his family's effort has created an NGO that deals with club food. One of the most difficult challenges across India in healthcare, and the ability of a private group to actually create an NGO that deals with it is quite extraordinary. If there was a game changer, that's where the game changer really lies. What I'm talking about is when will IMC turn around and invest in a think tank and say your job is to create a debate about public health policy in this country so that it infuses in the public debates options about public policy, that government is provided with capacity to reimagine public health. This is a bridge between private contribution to economic growth, to social growth, to the citizens' welfare that I think that I would put in front of IMC. So let me suggest that today, the game changer for tomorrow is reimagining public health. And the game changer for tomorrow is how the private sector and groups like IMC will be a partner in the dialogue to change public health. Public health, which is about prevention, not about cure. Cure, I can see pharmaceutical firms, I can see all of you coming into that game, not worried about it, not worried that you will use digitization and IT to do it. What I worry is where will your dialogue, your voice be about taking India's public health, taking South Asia's public health to the next generation. And I hope that you will raise your hand when asked, are you a partner in public health? Thank you very much.
Thank you, sir. Thank you so much for your wonderful words. We are truly humbled and honored to have you here. And now, ladies and gentlemen, it's time to move ahead. And please allow me to invite Shri Juza Khorakiwala, Vice President IMC, to felicitate Shri Rajesh Tope, Honorable Minister for Public Health and Family Welfare, Government of Maharashtra. Ladies and gentlemen, sir, over to you.
Good morning, everybody. Though Mr. Shri Rajesh Tope is not with us, but we certainly like to acknowledge his contribution that he has made to the state of Maharashtra in particular, and in particular the stressing times that are amongst us. Shri Rajesh Tope is the Health Minister of Maharashtra since 2019. In past 1 year since the COVID-19 pandemic began picking up momentum in India, the Health Ministry was first one to take action to curb the spread. Housing the most densely populated cities in India like Mumbai, Nagpur, Aurangabad, it was imperative to act fast to break the chain of infection as soon as possible. Under the able leadership of Shri Tope, Asia's largest slum, Dharavi, became a case study across the world where the spread of COVID-19 was effectively controlled and contained with timely contact tracing and door-to-door testing. The ministry was quick to create mini containment zones to curb the spread, augment capacities by building makeshift COVID treatment facilities, and simultaneous campaign for promoting COVID appropriate behavior. All these measures were instrumental in managing the pandemic and saving lives. Maharashtra introduced Mission Begin Again in August 2020, which included a very meticulously planned strategy to open up Maharashtra's lockdown and economy. Faced with another surge in the cases, Shri Tope has been tirelessly working to ensure that the healthcare system doesn't crumble under pressure and all the necessary requirements for treatment is adequately made available, while at the same time vaccination drive is continuing uninterrupted. Considering the current situation as well, we are very positive that you'll be able to continue to contain the surge and manage the pandemic with your able leadership. In recognition of your role in handling the pandemic in the state of Maharashtra, that ensures timely preventive measures and lowering the mortality rate, the IMC Chamber of Commerce and Industry applauds your contribution to the public health and facilitates you as a game changer. Thank you, Shri Topeji, for accepting our citation. Thank you very much.
Thank you, sir. Thank you for your wonderful words. Ladies and gentlemen, unfortunately, Shri Rajesh Tope is not present here, but he has been kind enough to send his address for his attendees. I would request you to play the video.
Namaskar. At the outset, I'll take this opportunity to congratulate all the organizing committee members and the participants in this next generation healthcare summit. It's indeed an pleasure for me and an honor for me to be the part of your summit. I should also thank you for felicitating me, for actually doing a good job in containing the virus in Maharashtra. But I should place before you that it's my humble duty and responsibility to serve the community and the people of Maharashtra, being the Minister for Health in Government of Maharashtra. But yes, your patting on my back by felicitating will 100% encourage me to do such type of good work in the near future as well. Friends, from the perspective of government, I always believed in 4 A's of health sector, especially in public health. The first is the accessibility. Second, the affordability. Third, the accountability. And fourth, yes, of course, the acceptability. So, we should always take the necessary efforts in giving the accessibility of healthcare to the people, especially to the rural people of Maharashtra and our country. We need to strengthen our primary healthcare centers with the good doctors, medicines, equipments. We should also upgrade our rural hospitals as well as the district hospitals. I am thankful to Government of India that they had been encouraging to give even the medical education facilities, setting up of colleges in every district. I am really proud to share to you that Government of Maharashtra is also not behind in this aspect. We have sanctioned at least 5 to 6 colleges in this year, and I'm looking forward to sanction more in the coming years. So that will provide the tertiary care in that respective district as well, because the college is attached to a 500-bedded hospital which has a tertiary care attached to it. So accessibility is important. Affordability also, there are a lot of schemes coming up. We need to do more. The Pradhan Mantri Garib Kalyan Yojana, in Maharashtra the Mahatma Phule Jan Arogya Yojana, etc., etc. Yes, From accountability side, yes, we need to be. From the doctor fraternity, from the healthcare workers fraternity, we need to be more ethical. We need to be more accountable. We need to be more focused on the public at large. A common man should be the focus, and we should all try to see to the welfare of that common man. Yes, of course, in the pandemic situation, which we are experiencing since last year, that has taught us a lot. The spending on health sector was very less in the last decades. But now we need to strengthen our infrastructure. We need to increase our manpower and train manpower, especially the specialist doctors needs to be increased. The technology needs to be accepted and adopted. So I wish that this summit has a lot of sessions and that will enrich our knowledge and our confidence, as lot will be discussed in different sessions about technology, about education, about infrastructure in healthcare, about opportunities in healthcare, about pharmacy and alternative medicines. So all this panel discussions from the eminent speakers will surely enrich our wisdom. So, at last but not the least, I once again congratulate all the eminent speakers for giving their valuable time, and for the organizing committee, the president and the co-president or the co-chairman, even Mrs. Sunita Dubey, Mr. Poddar and their team for having this summit in this pandemic situation. Of course, my government has always been focusing on a common man in this pandemic situation. We have always ensured that a common man should not suffer. And so my department always has been upgrading and ramping up the health facilities. We have increased the number of beds. The doctors and paramedics has been appointed. We had done different reforms like 80-20 in private and government to get the number of beds to the patients which are increasing. Also, the different cappings of HRCT, plasma, even the RT-PCR has always been a torch bearer to the other states. The second wave which has come has surely developed many challenges in front of us. the supply of oxygen, the supply of remdesivir medicine is a challenge. But of course, we are finding out all ways and means as a solution for these problems. So I assure to the citizens of Maharashtra that we will keep serving you from the bottom of our heart, and of course the doctor fraternity, the health worker fraternity that has done a commendable job in the last year, and they are doing continuously. I take this opportunity to give them a big thank you, and the work will always be remembered in the coming years and generations ahead. So, looking forward to work hand in hand with IMC and government, I give my best wishes to this summit. Thank you, one and all.
Thank you, sir. Thank you so much for your wonderful words. We're truly humbled to have you here. And now, ladies and gentlemen, let's move ahead, and please allow me to invite a beautiful lady, Dr. Sunita Dubey, Chairperson, Health Summit Organizing Committee and Co-Chairperson, IMC Health and Fitness Committee, to read the citation for Shri Harshvardhan, our Honorable Minister for Health and Family Welfare, Government of India. Ma'am, over to you.
Yeah. Thank you so much. Thank you so much. Dr. Harshvardhan, Union Minister of Health and Family Welfare, Science and Technology and Earth Science, has a long distinguished record of public service, leaving his indelible mark in all fields of activity undertaken. An ENT surgeon by profession, Dr. Vardhan branched out in public life in 1993, thus marking the beginning of electoral politics, which saw him getting elected to the Delhi Assembly for 4 more successive terms, 1998, 2003, 2008, 2013, and to the Lok Sabha in 2014 and 2019. Dr. Vardhan's public life has marked by outstanding achievement in the field of health, education, law, science and technology, and environment. At the center stage of managing the present COVID-19 in India, Dr. Harshvardhan graded preemptive and proactive approach in strengthening health infrastructure, building capacity has been helping India through unprecedented health crisis. His exemplary work combating the pandemic in this densely populated country has won him applause across the world, even lauded by World Health Organization. Under his able leadership, India took all necessary steps well in time, including surveillance at the point of entry, evacuation of national standard overseas, massive community surveillance through robust disease surveillance network, risk communication and community involvement to ensure that India does not lose the battle against the coronavirus. COVID India Seva, a 24-hour helpline introduced by his ministry, provides an interactive platform for establish a direct two-way channel of communication with millions of Indians who have become victims of this newly deadly virus. This helpline is initiative between the Ministry and the Twitter India and has enabled transparent e-governance, delivering in real time, answering citizens' queries swiftly at scale, especially in the crisis situation like the ongoing COVID-19 pandemic. Considering the current situation as well as, we are very positive that you will be able to continue to contain the surge of manage the pandemic with your able leadership. In recognition of your role in handling the pandemic under very difficult circumstances of oversee timely preventive measure and lowering the mortality rate, the IMC Chamber of Commerce and Industry applauds your contribution to the public health and felicitate you as a game changer of India. Thank you, sir.
Thank you, Dr. Dubey, for your wonderful words. And now, ladies and gentlemen, it's time to conclude our beautiful inauguration session. And for that, I would like to invite Sri Joseph Korakiwala, Vice President, IMC Chamber of Commerce and Industry, and Chairman, IMC Health and Fitness Committee, for vote of thanks.
Good morning once again. Ladies and gentlemen, all the dignitaries who have graced this occasion today as speakers, moderators, and also our participants. This health summit has come at a very, very opportune time when health is topmost in the mind of all its citizens. Today's deliberations cover comprehensively all aspects of health via various panels which will follow, spanning the future of health through technology, infrastructure, education, the future of pharma, alternative medicines of healthcare, and digital healthcare. First and foremost, our gratitude to Shri Harshvardhan for his message, which will follow, while he's grappling with saving lives and livelihoods at a national level. And so also Shri Topeji, who gave us a wonderful presentation of what Maharashtra government is doing. A grateful thanks for being with us this morning. A very special thanks go out to our sponsor, Mr. Charak Pharma, a very dynamic organization in India in the Ayurvedic field of medicine, whose chairman, Mr. Ram Shroff, readily agreed to sponsor this event. Thank you so much, Mr. Ram. I must thank Dr. Sunita Dubey, the chairperson of this organizing committee, who is also a supporting sponsor, Medscape India, for putting this event together. And a profound thanks to all our speakers, particularly Mr. Raj Nair, who unveiled the white paper, who has worked so diligently over the last 6 months to come up with this white paper on affordability and accessibility. Mr. Siddharth Shah, who talked about connecting the dots digitally across the ecosystem of health. Mr. Manoj Jalani, Director of WHO Southeast Asia, who gave a perspective on what WHO is doing, not only in India, but entire Asia. And of course, Mr. Junaid Ahmed, a very eloquent speaker who completely shifted the narrative from cure to prevention of health and public health as a prevention, a totally different perspective and realization of public health as a means to prevent diseases and to prevent and improve health across the spectrum. Thank you, Mr. Junaid, for your such lovely words. Lastly, a big thank you to our president, Mr. Rajiv Poda, for always inspiring us towards this event, and the team at IMC led by DG Ajit, Sanjay and Chitra, who have worked tirelessly to put this event together. Thank you all once again. We hope you enjoy the panel discussion that will follow.